Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Now, most doctors wait years before starting a private practice, but today's guest, Dr. Larissa Assam of RopheMD, didn't. She started her practice being debt-free with almost no savings right after residency, and the lessons she's learned might challenge everything you've been told about playing it safe. But before we jump into the episode, I just have a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. Grow Solutions helps eliminate some of the biggest headaches like new patient lead generation, operational chaos like using proven systems and frameworks that we can implement for you. And yes, we do help you with AI and those crazy robotic agents that are coming whether we like it or not. So if you've ever thought this or said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your growth solution. So just drop the word grow below in any of the comments, or feel free to reach out to me on any of the social platforms. But you're here for a reason, and that's to hear from our guest. Dr. Assam, welcome to the Prime Health Podcast, and please tell us a little bit about yourself.
Thank you so much for having me on today, Dr. Barron. I'm so honored to be here. I absolutely love the work you're doing. And just to share a little bit about myself as we get started. So as we mentioned, my name is Larissa Assam. I'm a board certified family medicine physician. And I actually started my journey into medicine as young as 7 years old. My dad was a doctor, and so I grew up in a medical household, so to speak. My mom was a pharmacist, and at that age, he had a terrible car accident with injuries to his brain, his spinal cord, and also his neck. And we were living in Cameroon at the time. The doctors told my mom, I should say, that if we had any chances of him surviving, then she needed to get him out of the country immediately. And that was just because at the time, the critical care infrastructure in the country just couldn't handle the severity of injuries that he had sustained. And so very quickly, my parents were medically evacuated to the UK, and we didn't see them for 4 months. And that opened my eyes at a very young age, at 7, and I'm the first of 3. So although I kind of knew what was going on, I also had my younger siblings to think about. And so at a very young age, that opened my eyes. That also started my journey. I'm very big on my faith. That also started my journey with the Lord, because during that time, my grandmother came to live with us, and she literally put us on a prayer schedule. And so, because that was our only hope. And so we would pray. We knew there were set times. We would have pastors come to the house and pray around the clock. And 4 months later, my parents walked back in. We're actually at my grandmother's house that day, and my dad, all he had was a neck brace, which came off the next week. So 1, I witnessed a miracle, but 2, it really showed me, wow. So it just confirmed it. This is what I wanted to do with my life. So fast forward over the years, loved science, went through school. I genuinely enjoyed learning. And then when I finished high school, I came to the US. I went to school in upstate New York and did undergrad there. And I can share more details if you would like, but did undergrad, continued right away to medical school at SUNY Upstate in Syracuse, New York, and then took a gap year, came to Maryland and did a master's of public health at Hopkins, and then finished medical school and did my residency at Georgetown, family medicine residency. And to be honest, my plan was actually to work, for at least 2 or 3 years before any thoughts of private practice. But before I knew it, the Lord had other plans, and I was preparing behind the scenes, just writing ideas and thoughts. But immediately after, it was go time, because that just seemed to be the only door that seemed to be opening, just starting my own private practice. So I am happy to dive more if you would like, but in a nutshell, that's kind of the story.
That's a big nutshell that you shared. I'm very happy to hear about your father's, hopefully good recovery, still, doing okay. And
Yes.
that's amazing. Shows the power of prayer for sure. As you and I kind of talked a little bit, prayer is really important in both our lives as we work on that. So I commend you for that. And, very East Coast on the States wise, you stuck all around that quarter, which is good. I've got some friends over in that area, so it's a beautiful part of the country and amazing schools that you were there. So what I would like you to, I want to dig deeper into how you started on your own. But before I do that, what would you say is unique about your personal practice right now? What makes makes you unique compared to others?
So that's a great question. And I think one of the things that makes Rofi unique is the methodology behind it. So I have, since day one, the way the practice is now is not how it was when I started. But from the very beginning, I have adopted an agile, iterative model of care. And so I am comfortable and okay with changing things along the way. I think that's one of the things that makes it very unique. As opposed to how we are typically trained in medicine to kind of find something, stick with it, and keep it going. One of the things I've learned is that a very quick way to learn in medicine and also in business is to iterate. I noticed that Apple does this a lot. They don't look to put the very best out. They put a product out, and I believe now we're at the iPhone 16 or 17. I don't know which one it is, but if we look back, it's changed so much compared to the original iPhone. So I've applied this same methodology, and now I'm doing a lot of root cause medicine. Another thing that's very unique about my practice is that it's faith driven. And so a huge element of what I do is actually prayer. Sometimes it looks like praying with my patients, but really majority of my work, I would say, is praying behind the scenes, interceding for my patients. And so it helps whenever they come to mind. If, let's say, someone whose name is Sarah, of course, that's a de-identified name, comes to mind, automatically I know to go into prayer, and I have set times of the day for that. That's something I'm still working on. It's still a work in progress, but that is a very huge element of my practice. And I think the outcomes show. Not only are there, it's been a great experience. Thankfully, we're just about to hit 2 years, but I think the impact that each person can say they've had since being a part, for me, it just warms my heart.
Yeah. I will tell you, Dr. Larissa, that's amazing how you think of a patient and then begin a prayer at some point in time for them, which is, as you said, behind the scenes. And I hope that they know that you do that. Maybe you share it with them, maybe you don't, but I'm sure that they would be appreciative of that. So that's amazing. It's a true testament to who you are in your faith. So I love to hear that. Thank you for that. In regards to those iterations that you've done, what would you say, was there big reasons to make the changes from day one that you started? Like, what caused the iterations?
Great question. So I can talk about that from two perspectives, from a business perspective and also from a clinical perspective.
Okay.
So let's start with business. When I started, I didn't have money saved up in the bank. Actually, I trained in the DMV area. I didn't have very much saved up, and I, again, was not planning to do this at all at that time. Maybe if I knew that that's how things are going to go, I'd have been a lot more frugal, even. Not that I was a big spender, but just a bit more intentional. So, very early on, I had to learn how to build a lean private practice. And so, I couldn't go and take a big bank loan. Well, maybe I could have, but I didn't believe that was the direction I was meant to go take like a bank loan. Not that there's anything wrong with that, but I just felt for my specific situation, it just wasn't the best decision for me at the time. And so the first thought was, okay, I want to have an office and this and that, but right now, what's in my hand? What can I absolutely work with, right? So I said, okay, I have a computer, I have internet, and I can see patients. So let me start with that. And then I started to offer home visits in like a concierge format. And at the time, I thought to myself, okay, I did about one or two of those. And I was like, I actually don't like driving that much. It's the DC area, there's a lot of traffic. So this could work, but with my current price point, that may not be the wisest use of my time. So let me leverage the virtual setting. Now, a few months into starting, I want to say maybe 8 months after starting, I did get an office space. I got a small space and I said, I'm just going to do this. And I believe, people want that physical location. It's surely going to help. And then very quickly after the first two months, I observed even those who were in the area where the office was located were still opting for virtual visits. And so by the third month, I said, nope, we're going to close it and we're going back virtual. So if you really want that in-person feel, then you will need to have a home visit. So I didn't take them away entirely, but the research also shows that 90% of primary care concerns can actually be addressed virtually. And so I realized, like, okay, I think if I can really hone in, provide an excellent experience virtually, then there's something here. I can really hone in and leverage this. So those are just a few examples, business wise, to show, okay, what's my overhead looking like? Do I absolutely need this for growth at this point in time, or can this wait a little bit? And if I think of it clinically, I've developed personalized protocols. I actually started this when I was in residency because for some reason I would just get the patients who would be very honest with me and just say, Doctor, I know you're about to put me on this blood pressure medication, but I'll be honest and I'll tell you I'm not going to take it. And so part of me would be a bit astounded and would say, thank you for the honesty, but then I would go back to the drawing board and say, well, if they're not going to take the medication, what can I do? And I didn't know that that was my early introduction into a more root cause approach to care, a more lifestyle medicine approach, and even a functional medicine approach, I dare say. And that's where it all started. Now, the protocols I was developing in residency compared to what I have now, they're vastly different because I've iterated on them as time has gone on. I continue to do, that's a huge part of what I do, research. What is the research showing? How can we make this better? Are there some foods, some other things we can do, types of workouts which can be helpful that we can integrate to make a change more sustainable for a patient? So my protocols, I love them. They're great. Patients can follow them, but they're not set in stone in the sense that they cannot be changed. If something is not working and I notice a pattern in multiple patients, then I'll just try and see how we can improve on it.
Okay. You said it, the word, or I guess the phrase a couple of times, root cause. Do you mind sharing specifically what you mean by that? And I guess I will say it, Dr. Assam, that from your practice versus if you were in a clinical setting at a hospital, are they doing root cause? Maybe some are, but most are not. Would you say that's correct?
Yeah. So for context, I trained in, I believe, some of the most academic of academic settings, right? I was at, tertiary care hospitals throughout my training. We did groundbreaking research. I actually was part of the team at Georgetown that did all of the testing on remdesivir and convalescent plasma and all of that when I
Wow.
was in residency. So my brain was wired that way. But when I started to have these real life patient encounters throughout my residency, I just always had the notion that I personally wouldn't want to take a medication for 20 years. And just because I was diagnosing someone with high blood pressure or diabetes didn't mean they needed to be on a pill forever. But what was it that was causing them to have the elevated blood pressure? The more I researched, the more I realized no, there's something, even if you want to say there's a genetic component to it, what is it about the way this person is eating or living that's causing the problem? When we take a step back, I'm going to use this example because I don't think it's talked about nearly enough. Let me talk about pregnant women. According to the WHO, 80% of maternal deaths are actually preventable. Okay, so 4 out of 5 women who die due to pregnancy or pregnancy related conditions, 4 out of 5 of those deaths are preventable. So then we must ask ourselves, well, why is that the case? Why are women still having these issues? And the reason, what leads to the deaths is complications in pregnancy. Then you ask yourself, okay, what is it that causes the complications that are happening in pregnancy? And when you take a step back, what I've come to find is that inflammation is the biggest driver. And so when we adopt the root cause, we're saying, okay, I know that the outcome is death or the outcome is a complication, but what actually led to that? Was it stress? Was it poor diet? Was it the lack of exercise? Was it something else? Maybe hormone exposure, what have you. But it really makes you take a step back and ask a few more questions. It runs in the family, but why does it run in the family? Has everyone in the family, even though I'm just going to use this for example purposes, okay, high blood pressure or high cholesterol, I should say, but does everyone eat, maybe a pound of pork every single night, right? What are the things that could be contributing and creating this pattern that we're now seeing? So it really makes you get to the root. And I find that if you can address it, then oftentimes you can really help people a lot.
Yeah. When you say you can help a lot of people, I would say that the way you treat, there has to be a lot of trust that's involved. And so there has to be, if you have patients that come from the typical hospital setting or a clinical setting into your practice, number one, you've got to gain their trust. And number two, you've got to make them make a mental shift in how they care for themselves. Is that how it runs in your practice?
I agree. I think, in the hospital, outside of the hospital, I truly believe that medicine is a calling. And I remember when I was in residency and even when I was going through my own personal things, one of the things my assistant program director at the time had said to me, she said, you have this way of being calm and collected, even when it's like there's a fire right inside the room. And I think that medicine is truly a calling because I can talk to you about science all day long, but if I don't make you feel safe and heard, then everything I'm saying will go out in one ear and out the other one. But I like to have people envision what they want for themselves because I can tell them anything, but it doesn't matter what I say. It's really, what do you want, right? Do you want to be on the medication? If you do, that's fine. But oftentimes it's like, doc, I've been dealing with this for a long time. And I think they just feel a bit heard, so to speak. And so that allows us to then work together to be able to achieve whatever health goals we're working towards.
Yeah, that's a great approach. Patients need somebody that is willing to listen to them because in the typical medical model, you have 7 to 12 to maybe 14, 15 minutes, and that's it. And I'm sure you take a little, it's not anything, it's just the way it is. But in, your root cause practice, it sounds like you may be able to spend a little bit more time with them.
Yes.
Yeah.
Yes. And it goes back to starting at age 7, growing up in Cameroon. there is a way in which I saw medicine being practiced. And when I really thought to myself, when it was time to decide what do I want to do with my life, how do I want to practice? Yes, I knew for some time I would work, but that I knew that that would just never be the best fit for me. I'm very relationship driven, and when I pictured myself as a doctor, it was very big on, I mean, my dad's patients used to bring us food. They used to bring us, it was very like community driven. You see people out in town and you get stopped and that kind of thing. But that's what made it so precious and special. It's because there was a degree of relationship there. And so for me, I even talking about pivots, I took insurance this year, 2025, but I've decided next year I'm going back to exclusive membership based medicine because it just allows me to have time to just really spend time with the patients and remove the bureaucracy that's necessary for insurance. And it's just a model of care that I always envisioned practicing. So that direct primary care slash concierge model works better for me.
Yeah.
And I dare
And
see my patients too.
yeah, I was going to say, if it works good for you, it's going to work better for them because you're happier in that situation. You'd rather be treating them that way. From the business side of it, what conditions mostly walk through your virtual door of your practice?
Yeah, I was actually reviewing the end of year report. The most common one we saw this year was obesity.
Mm,
My patients lose an average of 10 to 15 pounds per month without medication. And so we had a lot of weight loss cases this year, which is actually hilarious. I always laugh and tell my patients because I was a chubby kid growing up. And so that's the most common. And then the next category I would say would be a mix of hypertension and diabetes. But really, I've seen quite a variety. So a lot of autoimmune conditions. I have patients who even have cancer that are under
mhm.
my care. And so there's quite a variety, and we'll see what next year brings.
Yeah. Well, hopefully all happy patients is what we want, happy and healthy
Yeah.
and well. Yeah, so they can pay for everything that goes along with that. Have you noticed in the last year or so, like I know this has been weight loss, but has there been the demand for people to come in and say, I want that injection assistant weight loss? Are people saying that, or are they okay to go with the natural approach that you'll bring them through?
That's such a great question. So at Rofi, I made it perfectly clear that we do not offer any of the GLP-1 medications.
Okay.
So it's clearly stated when they try to schedule an appointment. It's just a personal decision I made early on. I have my personal thoughts about them, and so I have nothing against them, but I just have a personal thought because there's a certain model, there's a certain assignment which I have at Rofi, and that kind of goes against that, so to speak. Not that there's anything wrong with them, but for the purposes of maintaining the integrity of the assignment that I have at Rofi, it just did not. It wasn't really the best fit. So I make it clear to them. I actually have a patient. She came and she had actually been on one of the GLP-1s for a whole year. Unfortunately, didn't lose weight. And then I put her on the protocol, and within 40 days, she had lost 35 pounds. So some people will come, they're already on it, but I wouldn't prescribe it for them through Rofi. That's fine. I can't control that. But I always tell them, even if you're going to be on this medication, you still need to address the lifestyle part because the research shows us that unfortunately, once you stop taking it, because there really has been no change in behavior, again, getting to that root cause,
Mhm.
unfortunately, that weight tends to come right back, and we wouldn't want that. So,
Yeah, that's very good. I mean, that's a big choice that you make of not seeing. And of course, you could iterate and make those changes. It's not that it could be forever, but at least at this point in time, that's where you stand with it. And again, that's great that your patients, I mean, that's a testament to what you do, that your patient got a benefit after being a year on the medication. And then they finally see you and they have 30 plus pounds of weight loss. That's amazing. That's transformational for sure.
by God's grace,
Yeah,
truly.
very good. Very good. So what would you say, where do most of your patients come from? Are they nationally, regionally? Where do they come from?
Yeah, such a great question. So, I find that most of my patients find me on social media.
Yeah.
Instagram is the main channel I use, and later in the year I started to leverage LinkedIn as well. Still growing in in that avenue, but Instagram has been the biggest one thus far. And in terms of location, funny enough, I have quite a few from Maryland, but New York seems to be a really big one.
Yeah.
I've actually had some patients even reach out from outside of the country.
Mhm.
Um, and so it's quite varied, but that's what I would say.
Okay. What would you say is the challenge that you have in your business?
Hmm. I would say, what's my challenge? If I had my way, I think I would have grown a lot more. I'm thankful for the process I've been on because now I know what it looks like and feels like to start with a zero-based budget, so to speak. But if I had my way, I would have started with like $100,000.
Mm-hmm.
And I think it would allow me to make a few investments to do a lot more in terms of service provision, in terms of even marketing. And
Hmm.
so I think if it's possible to have some sort of like savings or investment, so to speak, that would be great. But I'm also grateful for the journey because I think I was reflecting and I'm like, I'm glad I took insurance because now I can speak about that from not just from knowledge, but from experience.
Hmm.
And I can talk about both the pros and the cons. So that's what I would say.
Yeah. I think sometimes there are more cons when it comes from the provider side and more pros on the patient side. At least that's what they like to think. And it's that little bit of battle. They have to understand that insurance is really not as much of a benefit as they think it is because it's taking away more than who they could see, which is
Absolutely.
unfortunate. Yeah, it's a difficult part within that. But if somebody were in your position starting over, and just leaving residency. I know that you would like to have somebody gift them $100,000 to do that, but what are some of your maybe tips or tricks to help them grow that business from that point?
That's a great question. So I would say use what's in your hand and go lean.
Okay.
Sometimes we want to buy the biggest machines, the fancy offices, and all the things. But to your point about making patients feel seen and heard and valued, I personally believe that that's the only reason why patients come to me, to be
Yeah.
honest. Because if they wanted the bells and the whistles, I don't really have that to offer to them, right?
Mhm.
But I can. They will recurrently report Dr. Assam did this or that, and it really helped me in this way and it helped my family. So understand that you already have something in your hand. You have your training. Start virtual. I think that's a great way to get started and really hone in on what you actually like. The
Mhm.
work I do, I genuinely love it. I can wake up from my sleep and I can do it. And that's the beauty of private practice. No one's forcing you to do anything.
Yeah.
You get to decide. I actually didn't really want to do prenatal care, but I now realize that this is a calling. So the joy I derive from it, I never would have expected to have.
Mhm.
But some way, somehow, here we are. And it's one of my most favorite patient populations, so to speak. And so use what's in your hands, start virtual. Once you get your license, you can get malpractice, of course, and then honestly get started. Even before there was a time I didn't even have an electronic health record. You can
Mhm.
use HIPAA compliant like there's so many tools out there. And in today's day and age, leverage AI. That's a huge part of my practice. I love that you mentioned that that's one of the things you do as well within your offerings because we're in the era of health tech and we want to be creative and innovative and stay with the times. So I think there are a lot of virtual tools and digital tools that can help you. And if you would, of course, love to speak more on this, I'm more than happy to connect.
Yeah, love it. We'll share all of your contact information for people to reach out to you, and we'll get to that point in a second. Before you share that, though, could you share a success story with us about a patient that has come through your care?
Yes, please. So let's see. I had, trying to see which one to pick. So I had a patient with hidradenitis suppurativa, and she had undergone surgery for one of the wounds that was present in her axilla. It was excised, but the surgical wound would not close for 8 months. So when we started working together, I put her on a protocol, and when I do that, I also have follow-ups built in to just make sure that they're doing okay. 2 weeks, 3 weeks into her protocol, when we had the check-in, the wound had closed completely. So she went from having an 8-month-old wound that would not close to now having a wound that closed within 3 weeks on the protocol. And this was really about just changing a few, I dare say, basic things in her lifestyle. And, she was successfully able to do that. I can share. It's hard to pick one. Each
Yeah.
of them have been so impactful in different ways.
Yeah, Dr. Sam, and that one specifically with the protocol, was it also really related to an inflammatory issue?
Yes.
Really? Yeah.
Yes, please. Because if we look at the pathophysiology of hidradenitis suppurativa, we know that there's an underlying inflammatory root, so to speak, associated with that condition. And so if we're going to do anything and have any success at reversing it, then we do need to tackle whatever is driving inflammation in the body. And so if you eat anything that can cause inflammation, then it's only going to flare it up. But if you can create an atmosphere in the body which kind of, I don't want to say starves, but reduces the chances of the body being inflamed, then we're now actually creating the right atmosphere in the body for healing to happen. And so I believe in her case, speaking scientifically, that's what happened. And by 3 weeks, that was possible. Now, it's one thing to get such outcomes, but I'm also learning that it's another thing to sustain them. And so
Mhm.
this is where that co-creation with clients comes in, because again, it's like, hey, we don't want this coming back again. We don't want this flaring up. And again, if we talk about things that run in people's families, if you're already prone to certain things, then you might need to be a bit stricter or choose a bit differently from someone else. I have another patient with Crohn's right now, and he's gone after back-to-back hospitalizations. He's currently on, yeah, this is actually week 5, no flare, and he was getting flares I want to say every week or every other week. So I'm just grateful. I'm just
Yeah.
grateful.
Yeah. Well, it sounds like your protocol is fantastic, that people follow. It sounds like they get results, which is amazing. And if people would like to learn more about you, reach out to you, whether they're locally to you there in Maryland or they're in Idaho where I'm at or anywhere across the world, how would you like them to reach out and get in touch with you?
Yes, please. So they can send an email to the RopheMD page. It's info at RopheMD.com. But I'm also on social media platforms, Instagram, TikTok, LinkedIn, Facebook even. And that would be, at least for Instagram, at drlarissa.md,
Okay.
drlarissa.md. And then Rophe also has a page, which is ROPHEMD on Instagram. So that would be my recommendation,
Okay.
please.
I'll make sure that we add all of those links in the description so people can reach out to you because I think it's important. So, two last questions, if I could, Dr. Hassan. Um, Number one would be if you could give us one piece of advice that would affect our health in a positive way, what would that advice be?
Invest in your health.
Hmm,
You're either going to pay for your health now or in the future. So
very
it's
good.
in your best interest to invest now. Don't look at it like you're spending a ton, but you're literally investing. And
Yeah,
so you're going to pay, there's a cost either way you look at it. So I would humbly recommend that you just invest sooner rather than later, because
yeah.
that will keep you for the long haul.
I love that one. Yeah, all too often people don't understand. That goes back to the insurance, is that they think insurance is going to take care of them. But if that insurance is pulled away from you, you still have to take care of yourself, and you find a fantastic provider like yourself that can do that for them. That's where it's important, but it really is an investment in your health and in your future. Yeah. So last question, Dr. Assam. You're on the Prime Health podcast, and of course, I appreciate you being a guest. It's been fantastic. But if you could give us your definition of what Prime Health means to you.
That's such a great question. So I would define prime health thinking of the word prime, which means first and foremost. I would say it is, for lack of a better word, or better phrase, I should say, it's living the way God created you to be in the first place. You were never created to be sick. You were never created to be disease laden. You weren't. And just because you've had a diagnosis for the last 20, 30 years doesn't mean that that has to be your life forever and ever and ever. Just because it runs in your family doesn't mean that that needs to be the case. So I think it starts in the mind. And if I can use that phrase, the word prime health, I would even say your health, it begins here. It begins in your mind. It begins with how you think of your health, yourself, and whatever disease you're trying to tackle.
Yeah. Have you ever heard of the phrase called metacognition?
No, please tell me more.
Yeah, it's thinking about what you're thinking about. So if we continually to have negative thoughts about our health, we attract more negativity into our life. If we think about ways in which faith can help us in our life and or in our health, we'll have more of those positive thoughts. And it's much easier, I'm going to rephrase that, it's harder to get rid of more negative thoughts than it is to bring in positive thoughts. So we have to always be thinking about what we're thinking about. And I think you, by your definition of prime health, it's fantastic. I love it. It fits into the way I think. So that's wonderful. Thank you for sharing that.
My pleasure. I love the name.
Yeah. Oh, wonderful. Well, Dr. Assam, thank you very much for sharing your unique perspective and your story. It's unfortunate, but I think for everyone's outcome in the end, maybe it was a blessing that your father went through that for you to experience what you've experienced and the strong desire to help other people in that direction. You know, I'm sure you would have still maybe gone into medicine regardless, because I think that really is your calling, but it drove you a little bit harder into that, which is good. And I appreciate your grandmother asking you to set aside time for prayer. Really good that she did that. So maybe you didn't like to do it at the very start, but I think, again, it's bled off into the fact that you're doing that for your patients as well. And I would ask for any of the viewers that have watched this or listening to this, please do Dr. Assam a favor and share it to at least one friend or one family member. She sounds like she has phenomenal results with her clients. It sounds like she is truly a woman of faith and has a heart bigger than we know from this conversation. And maybe just a conversation could help, but I'm sure care can help along the way. So we would like as many people as possible to see it, but just think of that one person that could benefit from it, which I think is important. Selfishly, I always say subscribe to our podcast. We'd love more people to do that if we could. And then until next time, remember that true wellness is a journey that we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Assam, thank you very much for being a guest on the Prime Health podcast.
Thank you so much for having me. I truly enjoyed being on today.